A new report by Andrew Longhurst at the Canadian Centre for Policy Alternatives highlights the real looming threat to privatization of Ontario hospitals. The report is quite in-depth and highlights the problems with the expansion of for-profit surgical and diagnostic delivery in Ontario, including how it could worsen staffing shortages and destabilize public hospitals, as well as unlawful extra billing and two-tiered medicine. And that's besides the fact that it costs more and creates worse patient outcomes. And the report also highlights how our healthcare system has not recovered since COVID. The report highlights the massive difference in stated government expenditure on private clinics versus the actual spending. Which makes you wonder, if there's not enough money to fund public hospitals properly, why are we spending this scarce resource on private clinics? Clinics that don't decrease wait times in the province. As the author of the report says, increasing surgical and diagnostic capacity depends on the availability of qualified staff. You can't just wish them into existence overnight. Unfortunately, less and less people every year want to work in Ontario's healthcare system because of Doug Ford's chronic underpayment of nurses and other staff, as well as the demonization of unions and public sector workers. Recently in Ontario, we had 1,300 patients on stretchers in hospital hallways waiting for beds, with 170,000 patients waiting beyond the medically recommended guidelines for surgeries, and 17,000 of those being children. With 2,400 people dying last year in Ontario waiting for surgeries, with 9,000 dying waiting for MRIs and CT scans. Not to mention the countless ER closures that we've seen. But there are solutions, as we've seen at Sunnybrook, where they operated beyond 4 p.m. Keeping these operating rooms open later and on weekends, you can provide more surgeries, reducing the Toronto region waitlist by 24%. And this year, Ontario and Doug Ford are only increasing healthcare funding by 1.2%, which is less than the inflation rate of 5.6%, meaning that our healthcare woes are only going to get worse from here. We have the funding and the expertise to solve the healthcare crisis in Ontario, but I'll let the author of the report say it himself.
What makes the Ontario government's policy direction especially puzzling and troubling is that Ontario has among the best wait time performance in the country, and in large part because it has not allowed a for-profit sector to destabilize public hospital staffing where the vast majority of surgeries are performed.